little time out of your life to understand how your bodies work and how we can heal them and how they heal. Okay? How many of you in here, before you ever came to my office, heard of the vagus nerve? Okay, some of you did. Good for you. Okay? If chiropractic does one thing, and this is what I want you to remember more than anything else, there's one thing that chiropractic does. It affects and impacts the central nervous system. When I adjust somebody, we're not just taking a bone off a nerve, we're impacting the central nervous system and everything about it. Well, vagus nerve is part of that system, okay? Vagus nerve, if you look at a journal that came out, a magazine called New Scientist, this is back in August of 2023. It said, unraveling the secrets of the vagus nerve will revolutionize medicine. That an interesting headline. Vagus nerve stimulation is used to treat conditions ranging from inflammation to migraine, mapping the nerve's complex structure of more than 160,000 fibers. I don't think you need to do that to get the vagus nerve to work better, but if they want to, that's okay. Could usher in a new era of precision treatments. Vagus nerve is one of 12 cranial nerves. It exits from the base of the brain, right here. It comes across the transverse process of the atlas. So when you work on the atlas, you can actually affect the vagus nerve. It comes down in your neck just like this, innervates the heart, the lungs, and the upper 2/3 of the GI tract. And you have one on each side of your body. Now they do different things, all right? For example, I just went over that. The function of the vagus nerve is one of the primary parts of the autonomic nervous system. So remember what the autonomic nervous system is, right? Okay, it's a part of your system that you don't have to think about, like digestion, breathing, kidney function. The vagus nerve is a major part of the parasympathetic nervous system, which operates primarily with sex, rest, and digest. Those are the three areas of the parasympathetic, although we're going to learn a few more, all right? So you have the sympathetic part of the autonomic nervous system, the parasympathetic part. And these two parts of the autonomic nervous system are constantly balancing each other out. At least they should, okay? And the way you measure that is through heart rate variability. That's one of the primary ways. Now, I used to have a heart rate variability machine. I don't have one anymore, and I want to get one again. It's a very, very accurate way of evaluating somebody's health. Because what happens is the sympathetic nervous system speeds the heart up, the parasympathetic system slows the heart down, and when you have this balance, which is a lot of speeding up and slowing down, that's called heart rate variability. And the higher your heart rate variability, the healthier you are. Now, heart rate variability is not an irregular heartbeat. We're talking about the difference in the rate of the heart beating in hundredths of a second. And so the balance between these two systems is incredibly important. So if you look at the vagus nerve and how it connects the brain to the rest of the body, 20% of the vagus nerve information goes from the brain to the GI system, the brain to the body. So 20%. These signals control gastric acid, digestive enzymes, blood glucose. 80% of the vagus nerve fibers go from the stomach to the brain. So these signals control satiety, hunger, fullness, energy metabolism. So let me ask you a question. If 80% of vagus nerve fibers go to the brain from the GI system to the brain, what does that mean in terms of how your GI system affects brain function?
It has a lot to do with determining your health.
Yeah, and a lot to do with your determining even your mental health, your ability to handle emotions, your ability to not be depressed. There's a big correlation between that. So gut dysbiosis is one of the main characteristics of an abnormal vagal tone. And you know, when if you have irritable bowel syndrome, irritable bowel disease, guarantee you have gut dysbiosis. And the gut dysbiosis can be corrected. We have a protocol for doing that here. So abnormal vagal tone can lead to high heart rate, elevated blood pressure, digestion, constipation, diarrhea, swallowing, and stomach issues. Anybody in here ever know somebody who had trouble swallowing, like they say, you know, I just can't swallow, I can't swallow pills, or, you know, that's a vagus nerve issue, period. The vagus nerve controls swallowing. So if you have that, you know, we'll talk about how to deal with that here in a minute. So the vagus nerve has two branches, the ventral and the dorsal. Ventral is the front, dorsal is the back. The ventral branch innervates the heart and lungs and is responsible for positive states, positive emotional states, basically, like relaxation, social engagement. And what I have found is that when I fix a vagus nerve, and we'll talk about this a little later, I've seen this with people, their anxiety levels go down a lot. A lot of people, their anxiety levels just kind of relax, maybe not go away completely. The dorsal branch of the vagus nerve, the posterior branch, innervates your GI tract and can be a significant cause of metabolic slowdown, shutdown, and depression. Okay, so depending on which one of these branches of the vagus nerve is subdued or affected, can really affect your mood a lot. So the ventral branch of the vagus nerve is largely responsible for promoting restitution, physical and emotional health, friendship, cooperation, parent-child bonding, that type of thing. The dorsal branch can lead to metabolic shutdown. It can be immobilized with fear, shock, fainting. I'm going to talk about a patient later on in this talk that she came to me because she just fainted. Actually, her mother brought her to me. She just fainted all the time. She'd be right in the middle of doing something, she'd faint, you know? And we found out it was a vagal nerve issue. Imbalance in the dorsal vagal state can rob us of clarity, productivity, and the joy of living. When the dorsal vagal nerve activity is less extreme but chronic, it results in depression. So these are some of the examples of dorsal vagus nerve activity when it's not working right. Low blood pressure. I see a lot of people with low blood pressure. They're not all depressed, but I see a lot of people like that. The vagus nerve may explain why chronic neck pain patients tend to be anxious and depressed, because the neck actually affects the vagus nerve. So here's some other common problems related to the vagus nerve. These are things I see all the time. Migraines, dizziness. I can't tell you how many people I see that are lightheaded and dizzy. Anxiety, sleep issues, difficulty swallowing is certainly one of them. Constipation, diarrhea, I see that a lot. Immune dysfunction, excessive worrying, loss of interest in sex. I've seen all of that in practice. So what other issues, what causes vagal nerve dysfunction other than dysbiosis? Number one is any type of emotional shock that's unhealed. Now, we all have emotional shocks at some point in our life, but anything that's unhealed trauma can cause an imbalance between the two branches of the vagus nerve. And subluxations are a major cause of function in the vagus nerve. So who corrects subluxations?
Chiropractors.
Chiropractors, yeah, just kind of wake you up back there. Yeah, we correct subluxations. So subluxations are a major cause of vagal nerve dysfunction. So Adrenal stress is another cause. So what do the adrenal glands do? Fight or flight? Yeah, yeah. They, what do they produce? What are some of the things they produce?
Cortisol.
Cortisol? Yeah, okay. What else? Adrenaline, right? Good, good, yeah. Adrenaline, which is epinephrine, norepinephrine. What else? All your sex hormones. Testosterone, estrogen, progesterone, DHEA, pregnenolone, dihydrotestosterone, all of them. So they're the backup system for your sex hormones. As you get older, the adrenal glands kick in, and if they're weak, they're not going to produce estrogen and progesterone like they should. So it's really important that they stay healthy throughout your life. So stress activates the sympathetic nervous system. So how many of you have ever had your sympathetic nervous system activated? Yeah, okay. Like, you know, fear or anger or frustration, all of us have. Okay, how do we digest food when it's activated? Not very well. Are we hungry when our sympathetic nervous system? Not very much, right? So, so this is typical sympathetic activity right here. So constant stimulation of the sympathetic nervous system is going to inhibit the parasympathetic nervous system and the vagus nerve. So if you're under constant stress all the time, eventually that's going to shut down or really turn down your vagus nerve. So here's a really interesting journal article right here, and I want you guys to get this. This is out of a journal called the Annual Update in Intensive Care in Emergency Medicine, 2013. It's been out for a while. The name of the article was the vagus nerve, autonomic nervous system, and chronic critical illness. Now these are some quotes. I took 3 quotes out of this article. Many of the insults that lead to critical illness, such as sepsis, trauma, and major surgery, either caused or perhaps the consequence of profound alterations in the autonomic nervous system control. What does that say? What does that mean? Anybody? I mean, I just don't want to read this and just go on and like assume everybody got it.
But something you've been through that stimulates the autonomic nervous system can, like, how am I trying to say it? That somehow it causes the critical illness.
Or contributes. So autonomic nervous system imbalance contributes to critical illness, or can contribute to it.
So that's saying it's a two-way street, that it can, that one can cause the other or vice versa then?
Right. So if you, and in this article, it said, if you have and I didn't put this quote up, but I'm just going to say it. If you have an autonomic nervous system imbalance and you're exposed to something where you get critically ill, that could be the deciding factor on whether you get well or not. A predisposed, or whether your organs recover. Now think about this. What happened during COVID? A lot of people that got COVID, what? Got put in the hospital and they died. You think that many of those had autonomic nervous system imbalance? Absolutely they did. And this was never really addressed. Here's another couple quotes from this article. It's really interesting. The preservation of parasympathetic function. Now remember, the parasympathetic part of your autonomic nervous system is a part that heals, okay? It's a part that relaxes you and heals, which is otherwise rapidly reduced at the onset of critical illness. Also limits organ injury through a range of mechanisms. So they're saying if you can limit, if you can preserve parasympathetic function, you can limit injury to your organs if you're critically ill. That's a very, very interesting statement. It says intact vagal innervation limits cardiac and extracardiac inflammation and enables neural reflexes to reduce myocardial injury. So if you're having heart issues or a heart attack, if you have an intact vagus nerve, an intact parasympathetic nervous system, it's not going to be nearly as bad as if it's not. Okay? So when do you know when most heart attacks occur, by the way? Anybody? On Mondays. People go to work and they're under stress on Mondays, okay? Do you know what food is generally eaten before most heart attacks? Anybody?
Hamburgers.
Hamburgers?
Greasy foods?
Nope.
Something spicy.
Nope.
Sugar?
Sugar. High carbohydrate foods. So, you know, if you're going to work in a stressful job on a Monday, don't eat Fruit Loops for breakfast, okay? Not good, all right? So, healing the vagus nerve. One of the ways we do that is by healing the gut microbiome. I'm not going to get into how we do this here in the office because I have an entire talk just on the gut, but I have a gut healing protocol that works really well, okay? And so if you have a gut dysbiosis, which we can test for and find that out, then we can give you what you need to help heal that. So what about herbal and nutritional help for the vagus nerve? Ashwagandha, really good for the adrenal glands. Great tonifying herb to modulate adrenal function. Ginger, okay, so you can go to the Asian store, like we do, buy ginger root and make tea out of it in the wintertime. Put some lemon juice in it. It's really good, really, really helpful. You do that? Good for you. Good for your digestion, good for the parasympathetic nervous system. Prebiotics, curcumin and turmeric, really good for, what does curcumin and turmeric do to the body? Anybody know?
Anti-inflammatory.
Yeah, very anti-inflammatory. They do something else too. Let's see if anybody can get this one. It's a hard question. Okay. They help heal the gut. They seal up leaky gut. Really helps with that. Okay. Now, there's another herb that I didn't put up here that's really, really good for GI function and healing a dysbiotic gut. Does anybody know what it might be? Garlic. Good guess. I wouldn't use garlic for that, but that's a great guess. I use garlic for fungal infections primarily. It's berberine.
I've been hearing about berberine.
Berberine is that's my favorite herb, okay? Berberine does so many good things to the body. It heals the gut, it balances, it acts like a natural metformin and balances blood sugar. And it normalizes cholesterol. Okay, so if you have high cholesterol, it'll bring it down on its own. Okay, so and it also stimulates receptors in your body that are called GPL-1 receptors, which is the whole Ozempic thing is all about GPL-1 receptors. I'm going to do a talk on that in May. But it stimulates the same receptors as Ozempic does, so it really calms down appetite and does some other things to the body that are really good. So the most powerful vagus nerve stimulator that I know of is this instrument right here that I use with my patients called the stim pod. And we do this through the left ear. Takes about 7 minutes, and it can really make a big difference in vagus nerve function. And you don't have to do it a lot necessarily. Some patients need it more than others, but it's a very, very easy and powerful way to get the vagus nerve to work right. So this is I'm going to show you a couple of cases of patients I had. This is a 24-year-old female. This is one I was talking about before. Married, had a child. She lives 5 hours northwest of here. Her mother brought her here. She had many years of just randomly passing out. I mean, just at work, at home. You know, she couldn't drive because she didn't know whether she's going to pass out or not. She didn't know what no known cause. Had been to all kinds of ologists and internists. I saw her 4 times. I adjusted her. I put her on a Denerol to put the curve back into her neck. And the last time she came in, I stimulated her vagus nerve for 10 minutes with a stim pod and adjusted her. She fainted 3 times shortly thereafter and really hasn't fainted since. That really corrected it, all right? And she lives in a small town up in northwest Nebraska, and she knew of another high school girl who was having the same problem she was having. And she tried to tell this girl's parents, this is what they didn't want to listen. They wanted to take her to the Mayo Clinic, which I don't think was going to help her. But, if you know of somebody who faints a lot for no reason, probably a vagus nerve issue. Okay, here's another one. 71-year-old female, had been a patient of mine for several years. She responded well to chiropractic and nutrition, but unexplainedly began to develop the following issues: drops in blood pressure, stomach pain with uncontrolled diarrhea, heart palpitations, fatigue, inability to eat without pain, shortness of breath, fainted. Cardiologist performed a heart catheterization and found nothing. So she asked me to take a deep dive into her health issues. And what did I do? I adjusted her, did a vagal nerve stim for 7 minutes. 6 days later, she came back and all her symptoms were radically improved. She was not better immediately, but it took about 5 days for things to get better. So these are 2 cases that I've seen. I've seen other cases that have responded really well to vagal nerve stim. Here's some things you can do at home to stimulate your vagus nerve, like breathing exercises. There's a guy from Eastern Europe by the name of Wim Hof, and do you know about him? He wrote this book called Lessons from the Iceman. He has all these breathing exercises that he has online, and they're pretty good. Do I do them? Not a lot, but I should, okay? Because my vagus nerve works pretty well, actually. But breathing exercises work well. Meditation, exercise is really good. Yoga, omega-3 fatty acids, and working with your gut, as we talked about. Singing and chanting, really good for the vagus nerve. Splashing your face or your body with cold water is really good. Hugging, massages, and intermittent fasting. These are all things that work well for the vagus nerve. So the ones that I do on here is I do meditation, do a lot of exercise, omega-3 rich diet. I do, I finish my showers with cold water. I do a lot of intermittent fasting. So I do about half of those maybe regularly, yes.
I'd like to share something weird about me, that for the longest time, when I get really tired, if I stay up too late at night, all of a sudden I can feel like my heart is downshifting. And I know that I immediately have to go to bed. Not even 2 minutes, I have to go. But the first thing I have to do is hop in the shower and do a cold shower, especially the head and the neck. And then I'm able to go to sleep immediately. And that will take care of it. Otherwise, I would not be able to sleep 1 minute for the next 8-10 hours until the next sleep cycle. And so it kind of resets my sleep cycle balance, and happened the other night, and it was amazing what a difference it made.
That's probably affecting your vagus nerve, more than likely. Good chance that you are. That's really interesting. So another great vagus nerve exercise is lateral eye exercises. I don't do this one too often, but you can sit down and just look to one side, just hold it there for 30 seconds, and then do the other side for 30 seconds. Just do that for a couple of minutes. That can reset your vagus nerve as well. Hold until you swallow, yawn, or sigh. Okay, so that's pretty easy. Okay, good. So there are any questions about anything I've gone over?
Somebody that's watching online asks, does the vagus nerve have anything to do with the nerve pain after having shingles?
Boy, that's a great question. It could, but I don't know. I honestly don't know. Could. You know, be interesting to find out. It certainly could. So, any other questions? So there's just a couple of things that I want to ask a couple of favors of you. First of all, we're looking for somebody to work in our office part-time. And here's the qualifications right here. If anybody knows of anybody that just wants to, like 10 hours a week, not a lot, you know, work when Carmen is gone on vacation, we're just looking for somebody. And age is not an issue. I mean, you know, I'll take somebody that's 70, 75 if they want to work, okay? But I just want you to think about that if you know of somebody. There's some good benefits from working here. The other thing is who do you know that has some of these issues that might need some vagal nerve work done or some chiropractic work done? Because there's a lot of people out there, like this young lady, this 26-year-old girl, man, she's going from doctor to doctor to doctor and not getting anywhere and spending a lot of money. I mean, how much does it cost to go to a cardiologist? That's a little bit, you know? So some of you may know some people who just need this, need some of this done. It doesn't have to be done a lot, but it has to be done at least once or twice, okay? So I just want you to think about that and send them in. I'll talk to them, and we'll see if we can help them. One of the things that I found with people is that if somebody comes in, they have a lot of organ dysfunction, you can fix their organs, find the organs, fix them with the laser, and then do a vagal nerve stim. For a lot of people, that really helps. That can really help them a lot. So think about that, and if you know somebody who's looking for work, I'd love to talk to them and see if they'd be a good fit for our office. So any other questions? Yes, Paul.
Would vagal nerve stim or chiropractic be a good thing to do before an operation or after an operation that you're expecting to?
Both.
Right.
Yeah, definitely. I would do it before surgery. I would take several supplements too to get your immune system up so you can heal. And I'd take some anti-inflammatories because you don't want to go into surgery inflamed. I mean, that's a great way to have either a really bad result from surgery or not heal, is to go in inflamed. So get an HSCRP done, blood work, to see how inflamed you are. And if you're inflamed, I would deflame before I had surgery, you know, because you don't heal if you're inflamed. You can't, not very well at least. So good question. Anybody else? All right, 7 o'clock. Appreciate you coming tonight. In 2 weeks, we're going to do the talk on lifetime care, caring for yourself for a lifetime and what that involves. And then sometime in May, I'm going to do the talk on Ozempic. It's going to be a really different kind of talk. We're going to talk about how it got started, who discovered it, and then we're going to look at some natural alternatives to Ozempic, some things you can do that are natural, that don't have the tremendous side effects that Ozempic has. So we're going to do that. That'll be sometime in May. Okay, great. Thank you very much.